Too much testosterone can also be linked to more insulin production, and that's why we often see insulin resistance in women with PCOS as well. Thank you for having me. My name is Amy McKenzie. I have a PhD in nutrition, metabolism, and physiology, and I've been working in the field of metabolic health for the last decade and a half or so. And I am the medical and clinical director at Lingo, and I'm really excited to be there and to do this work in metabolic health because I think it's an investment that we can all make in our future selves and can really help us live the life that we want to live as we age.
What is insulin resistance, and how is insulin related to glucose?
When our glucose levels rise, the body wants to bring it back into balance. It wants to bring them back down. So the pancreas releases a hormone called insulin, and that helps lower our glucose levels. Insulin resistance is when the action of insulin to move glucose out of the blood and into our muscles and other tissues isn't as effective as it used to be.
When is the best time to start thinking about metabolic health?
The choices that we make today are an investment in our future selves. And I think it's also really important to realize that it's never too late, right? Even if we get to the point that we have prediabetes or type 2 diabetes, these conditions are reversible. You can put them in remission. So it's never too late to think about it.
Do you have any practical tips for wearing a CGM?
Absolutely. The biggest thing that I can say is make sure that it's a super, super clean area. So always wash it with soap and water, pat it dry, go over it with an alcohol wipe, let it dry, and then stick it on. If you are like me and you love to lather up with lotion after you get out of the shower, try to skip the lotion that day, at least in that spot, so that it has a really nice, clean area to put it on without any oils. If you have a lot of hair in the area where you're putting it on, you might think about shaving a little bit of a spot, but most people are totally fine to just stick it right on. When you're putting clothes on and off, just be careful to not catch it.
So we can measure our glucose. How does a CGM help people do that?
So a CGM is a biosensor that sits on the back of your upper arm. It measures the glucose levels of the interstitial fluid, the fluid that surrounds your cells. And the biosensor sends that data to an app where you can look at your real-time glucose levels.
Okay, can we talk more about PCOS? Tell us what it is and the relationship with glucose management.
Yeah, so PCOS, or polycystic ovarian syndrome, is a condition that's characterized by a number of different factors. If we look at the ovary on an ultrasound, we see multiple follicles instead of just one. And when we look at a person, we might see an overcharacterization of excess androgens like testosterone. And what that looks like is people might have acne, or they might have hair loss from the scalp, or they might have hair growth in other places like the chin or sideburns. And then sometimes we also see irregular menstrual periods. And the connection between that and glucose is what some researchers believe to be is the excess androgen production, so too much testosterone, because too much testosterone can also be linked to more insulin production. And that's why we often see insulin resistance in women with PCOS as well.
We talked about women's health a bit. Can a CGM help a woman who's trying to get pregnant?
Perhaps in some cases. So what comes to mind is that there are some women who struggle with fertility, and in some cases their doctor might recommend that it's good for them to try to lose weight, because research shows that even a little bit of weight loss can help women get pregnant and have successful pregnancies. And one way that people might choose to lose weight, for example, is to utilize a low carbohydrate diet or a low glycemic index diet. So these are nutrition therapies or diets that people can utilize to keep glucose levels more stable, and they're associated with weight loss. And if you're undertaking one of these diets or nutritional therapies, then you might use a CGM to see how you're doing, to see if you're adhering to that nutrition advice that you're working on with your doctor. And you will see that your glucose levels stay stable. And actually, research shows that people who utilize a CGM as that biofeedback tool to know whether or not they're adherent to that nutrition strategy are able to stick to that nutrition better, lose more weight, and improve other markers of metabolic syndrome better than if they didn't have that feedback.
Can you think of someone that you know or you've personally worked with who has really seen a benefit from managing their glucose?
A ton of people. What someone really said to me once was, I didn't know that I felt bad until I felt better. So there was a woman that I was working with, and she was embarking on a new program. She knew that she wasn't really unhealthy, or at least her perspective was she wasn't really unhealthy, but her friend wanted to lose a little bit of weight, and she said that she would do this program with her. And the program was focused on keeping glucose levels more stable. And she was a little bit hesitant at first. She had tried ways to lose weight before. She was like, they never work. I'm not really into it, but I'm going to do this for my friend. And she did it. And probably about 4 weeks in, she came in and she was talking to me, and she was super optimistic. She was talking about all of these new activities that she was doing. She kind of had this new outlook on life. She was telling me about how her aches and pains that she always thought were part of just getting older were gone. And she had lost a lot of weight in that time too. And she was really thankful to have sort of that opportunity to have a different experience. And I think that so many of us might also feel that way, where things are slowly changing and we don't necessarily realize it until we have that opportunity to really feel better and feel our best selves.